Conservative MP for North West Durham, the first Conservative to win the seat in its history, joins us. Good afternoon.
Good afternoon.
Do you have any doubts about this plan that you'll be voting on tonight?
Look, I think it's really important. One thing that I'm most concerned about going into the next election is these waiting list concerns. We've seen a massive increase in that due to the coronavirus pandemic. And the truth is that we're going to need to put more cash into the NHS in the short term, and in the longer term, we can shift that funding towards better social care. But I agree with some of the points that Anne-Marie made. I want to see that quality of care increased. That's why, and particularly with the social care workforce, we're seeing £500 million as part of this plan going straight into that from the start next year. So I think this is a balanced approach, but the key thing for me is to ensure that the NHS gets the funding it needs so that my constituents and those across the country, aren't stuck on waiting lists.
OK, but there are different ways of doing this. You can tackle the waiting list in any number of ways. And one of your fellow Red Wall MPs told Newsnight's Nick Watt last night, "I will now lose my seat." And his point was, traditional Tory voters will say, "Why should I vote for you? You're more left-wing than your predecessor." Ex-Labour voters won't vote for him because they don't like the idea of having to fund millionaires in the South to pass on their houses to their privileged children. And
I don't agree with that.
You don't agree with that?
And I don't think I don't agree with them.
You don't think you'll suffer there as a result of this?
I think what constituents across the country, wherever they are, want to see is their families being looked after by our NHS. They want to see those waiting lists brought under control. And what I think will, you're talking about elections and politics, one of the things that I was absolutely shocked by, looking at Politics Live just a few minutes ago, was a shadow care minister, the Labour minister, Alex Norris, shadow minister, saying that he would not sign up to more money for the NHS, and he wouldn't even now sign up to a cap on care costs, which was in the Labour manifesto. They're voting against, tonight, more money for the NHS. I find that shocking.
OK, but
really
you know
do.
that their argument is that, you're picking one element of it. The Labour argument is that this is an unfair way to raise money, that there are fairer ways to do this.
Well, that's a fair, there's lots of arguments about that, but somebody, an MP, for example, will pay £903 a year more on this. Somebody on an average income will pay under £200 a year more. Somebody on the national living wage of £8.91 an hour will pay £81 a year more. My mum, part-time worker in our NHS, she's going to pay about £40 a year more. I'm paying £900 a year more. The top 14% of earners are going to be paying the half of all this extra tax. I think that's a fair and balanced way of doing it, and I'd like to see what the Labour Party are proposing to do else instead.
Chris Giles, the economics editor of the FT, tweeted this morning, he just on doing the sums, that once the marginal tax rate, so any extra pound that a young graduate now gets back, once they paid off their student loan, once they paid off the increase in employer national insurance, they will end up having a tax rate, and this is somebody who should be paying basic rate tax, they will have a marginal tax rate of 50%, just under 50%. Are you comfortable with the way that it's falling? Even though, take your point, we've been hearing that 14% it's the 14% of the wealthiest that are carrying half the bill. It is still, though, being levied hard on young people who have been hit very hard in recent years.
I think that the gentleman you mentioned is, that's a much greater emphasis on how people pay the graduate tax in order to fund our universities rather than this. He was making a much broader point.
He just added up all the taxes, income tax increase.
Well, exactly. This itself is across the board is not that. It's really going after the tax will be on the higher earners, and actually I think that's the fair way to do it.
And lower earners, and that's the point.
No, it's much lower on lower earners. As I said, somebody earning full time in my constituency on a national living wage will be paying £81 a year more. I will be paying £900 a year more, and somebody earning over £150,000 a year, they'll be paying about £1,500 a year more. That's to me seems a sensible way of doing it, where the highest earners pay the most, and it's cash directly into the NHS, and also to deal with something that governments of both colours have kicked around for decades, which is trying to deal with this issue around social care. That's something that was in our manifesto, and I'm glad we're actually delivering on it.
Richard Holden, thank you very much.